sir. Thank you for your introduction.
Yes.
Good evening, all. Myself, Dr. Mirunalemi, working as a Siddha consultant in Siddha Clinical Research Unit, Safdarjung Hospital, under CCRS, New Delhi. So, in this COVID pandemic situation, we all doctors from various systems of medicine looking forward for immunomodulatory internal medicine vaccine to increase immunity. In spite of having all these, without a quality of sleep, immunity will not get boosted. So here sleep is superpower. With this note, I'm entering into my topic, a review on exploring evidence-based approach between immunity and sleep in corona pandemic, best of modern and Siddha system of medicine. Next slide. So let me give you a short intro about my topic. As I said earlier, the immune system plays a great role in response to any foreign organism. It gets influenced by sleep and the circadian system. The quality of sleep can increase T cells in our body that fight off infection. But whereas in COVID-19 pandemic, the routine of large population got altered and it also affects the quality of sleep. In Siddha system of medicine, under daily regime, that is Nalulukam, sleep, that is Nithirai, were highlighted as the one of the most essential factor responsible for healthy and fulfilling life. The quality and quantity of sleep equally influence one's good health. As a person deprived of sleep develops varied disorder. As per International Code of Disease, 50 sleeping disorder has been mentioned. So my objective of the study is to present available data on relationship between immunity, sleep in this COVID pandemic from both modern and Siddha system of medicine. So I have collected a few papers, that is PubMed scientific papers from PubMed database that is between starting from March 2020 till date with the descriptors of sleep, quarantine, COVID-19 and immunity. And Siddha literature evidence were collected from Siddha Noilaneri and Padatha Gunasindamani literature, Siddha literature books. In my first article, next slide, that is sleep and immunity in times of COVID-19. This paper analyzed the influence of sleep on one's immunity during COVID pandemic, which allows for an increased onset of sleep disorder correlated with worsening of mental health and making the body more vulnerable of disease. So in this article, it explains about how COVID pandemic affect mental health, followed by sleep, and followed by immune system. Again, due to this weak immune system, COVID may easily enter into our body. Here, in this article, it summarizes about sleep has a unique role in maintenance of immunity. The circumstance that affect its quality has been associated with the reduction in response to vaccine, the increase in vulnerability to infectious disease, and found that there was a greater susceptibility to cold related shorter duration of sleep deprivation. That is, if a person has a sleep deprivation of 1 day, may catch cold. When discussing about the immunity, it is divided into, next slide, sir. It is divided into innate immunity and adaptive immunity, both having an important component of communication, that is cytokines. So cytokines are the protein produced by cells of immune system that promote intra and intercellular immune response. So some of the cytokines involved in sleep are interleukin 6, that is IL-6, tumor necrosis factor alpha. Interleukin 6 is a pro-inflammatory cytokine. It plays an important role in reduction of anabolic pathway and increase the catabolic pathway. Whereas the function of tumor necrosis factor involves immunomodulation, apoptosis, and pathological response. In short, in COVID pandemic, what happens? The people may have an increased amount of anxiety, stress, leads to sleep, and followed by deregulation of this immunity, this inflammatory and antiviral response. So this paper concludes that if a person who is having already sleep depression, sleep issues in their blood, they have both CRP and IL-6. So when insomnia get added to it, they are easily prone for infection. So in my next paper, it talks about, next slide, Sleep and COVID-19. Consideration about immunity, pathophysiology and treatment. This paper summarizes about fear and uncertainty caused by coronavirus. That is the social isolation, self-quarantine, the restricted mobility and social contact, concern about financial resources and availability of supplies, the fear of infection, question about how long we have to get self-quarantine. So these will call these factors leads to stress in people, and eventually they will get a sleep disorder, and these sleep disorder is influenced by retinal stimulation like electronic device, and extended or night shift workers, healthcare workers, they are the victims of this lung infection inflammation due to viral infection. This is actually a narrative review. This also addresses the relationship between COVID-19, sleep, and as well as immunological aspects. In this review, they have also added a point that three European countries like Switzerland, Germany, Austria, the COVID-19 lockdown led to improved individual sleep-wake timing and overall sleep. So in this country, they had a good sleep. But at the same time, however, many people suffered from decreased sleep quality in this COVID situation. So the major factors are hyperstimulation by the media, being TV, newspaper, radio, and electronic device, shift work. So this leads to chronic acute sleep deprivation. So next slide, sir. This illustration clearly explains about how night shift workers are easily prone for COVID infection. In night shift workers, they won't have adequate sleep, which leads to antioxidant imbalance, inducing oxidative stress, and followed by they have a reduced immunological memory, and they are increased exposure to allergens. It leads to COVID, SARS-CoV infection. So next article. My third article is about COVID-19 melatonin as a potential adjuvant treatment. As you all know, melatonin is a hormone secreted from pineal gland. It helps in a sleep-wake cycle. This article summarizes the likely benefits of melatonin in the attenuation of COVID-19 based on putative pathogenesis. So, based on the clinical features, so next slide, sir. Based on the clinical features, pathology, and the pathogenesis of acute respiratory disorder. So, in coronavirus, what happens? There will be excessive inflammation, excessive oxidative stress will happen, and there will be a more inflammatory markers happening, which eventually it damage the lungs. So what happens? This leads to cytokine storm and subsequent progression to acute lung injury or acute respiratory distress syndrome, and often it leads to death. So if we induce this melatonin here, we all know melatonin, a well-known anti-inflammatory and antioxidant molecule, is protective against this the acute lung injury and acute respiratory distress caused by viral or any other pathogens. So in this study, it is reviewed that melatonin is effective in critical care patient by reducing vessel permeability, anxiety, sedation use, and improving sleep quality, which might be also beneficial for better outcome in COVID-19 patient. So notably, melatonin has a high safety profile. There is a significant data showing that melatonin limit virus-related disease and would also likely to be beneficial in COVID-19 patients. So these are the experimental they are conducting, and even more experiments should be done to confirm this one. So these are the modern data I have collected from PubMed scientific article. So now moving on to Siddha. Slide, sir. In Siddha, as I mentioned earlier, Noila Neri is a Siddha literature book. It explains about sleep under the topic of Nalulakam, that is daily regimen. Siddhas have mentioned certain procedure to follow with regard to sleep as a part of a daily regimen. What is Nalulakam? Nalulakam mentions the systematic order of everyday activities that every person needs to follow in order to avoid lifestyle disorder and related diseases. So it describes the methodology to take good care of our body and mind. Next slide. So they have given a sleep protocol. So how to sleep, where to sleep, in which position we have to sleep, how long we have to sleep. So first, what will be the best posture to sleep? By lying on the left plank and extended limbs. Which direction is ideal to keep our head during sleep? It is best to keep on east direction so that it promotes good sleep. It promotes good sleep and health. So where to sleep? Basically, here they have mentioned a special white silk cotton, and they have also mentioned Indian cotton mattress. So since it reduce the internal body heat and increase the amount of blood in our system, they have advised this to cotton. Then what are the benefits of sleep? Reduce the fatigue of five sense organ, generalized body discomfort, besides giving refreshment to the mind and longevity. Then is it right to sleep in daytime? So in Siddha, it is strictly mentioned that we should avoid day sleep since it increases the vada disease, and particularly on taking while taking oil bath, we should avoid daytime sleep, and the person who is obese should avoid day sleep. So what are the effects of sleep deprivation? So lack of sleep during night cause mental delusion and the five sense. It decreases the good activity of five sense, indigestion, etc. Next slide. Sir. So as I mentioned earlier, we have to sleep on left plank. So why we have to sleep on left plank? Sleeping in left arm helps us to maintain the flow of breath. Flow of breath. Previous slide, sir. So sleeping in left arm helps us to maintain the flow of breath through left nostrils, because breathing through a left nostrils will produce a good sleep. And it also mentioned how many hours we have to sleep. Previous slide, sir. So it is mentioned that we have to go to a bed between 9 to 10 o'clock, and we have to wake up between 4 to 5. Then we should not close our face while sleeping with a blanket, and we should avoid day sleep. Then followed by how many hours we have to sleep. It depends on the age of the person. So the age between 5 to 15 years can have a sleep for 8 hours. From 16 to 30 years can have a 7 hours of sleep, and the age group between 30 to 50 years can have a 6 hours of sleep. Person above 50 and or above can have a 8 hours of sleep. It's like, so what happen if we have excess sleep? In Siddha, it is mentioned. Next slide. So in Siddha, it is mentioned that even excessive sleep is also not good for our health. If a person sleeps above the mentioned increased sleeping mentioned hour, they will experience giddiness or headache, sinusitis, fever, fatigue, anemia, and blockage in blood vessel, anoxia, etc. So to get rid of this habit, we can follow certain treatments like having a single meal a day, emetic therapy, nasal installation, and applying of medicine in eyes, that is collyrium. Next slide, sir. So, as I mentioned earlier, that sleep urge, now we should control our sleep and do certain things. So, like urination, how we should not control the urge of feel of urinating, defecation, like that. It is mentioned we should not control the sleep also. If a person controls that one, he may experience headache, slurred speech, loss of hearing, and redness of the eyes. Next slide. To enhance the sleep, as I mentioned earlier, that I have mentioned two types of cotton. Another mattress type. This is nut grass mat. So this what it will help now. It helps in cure indigestion, ill effects of fever, and it gives coolness to the body, and it promotes good sleep. Having this palesura, that is a fermented rice, will reduce kabam and induce good sleep. How to make a fermented rice? So we have to add a water, to adequate amount of water to the boiled rice overnight. At morning, with that rice along with water, we can add a curd. and we can have our morning breakfast. It will help in good sleep. Even it is very good for our gut health also. Next slide. As we all are aware of this herb ashwagandha, it is mentioned in one study that the leaf of this herb contain TEG, triethylene glycerol, which positively affect the rapid eye movement. And another study suggests that 300 milligram 2 times a day can help you fall asleep faster and improve sleep quality. In Siddha, it is called as Amukha. We used to advise patients, particularly at night time, with warm milk. Next slide. Another herb is Korasani Omam. The part used is seeds. So dosages of about 125 to 500 milligram we can use. This also we have to fresh and make into a powder with the warm water. We can give to the patient who are experiencing insomnia, even dementia patients we used to advise. Another practice in Indian cuisine, that is usage of poppy seeds. So we used to dry roast the poppy seeds and make it a powder along with a palm candy at night with a warm milk will give you a good sleep. So that we use in Indian cuisine. Next slide. This as a home remedy. We can try this one. This is actually given in Siddha literature. That is henna flower. We have to fill our pillows with a henna flower. We have to use that pillow. So it helps in regulation of sleep cycle, and it regulates our body temperature also. It also makes our body cool. So the flower of this henna majorly have a potent terpene, which is largely responsible for this pungent odor. Since this has some essential oil and it is rich in this terpene. And scientifically, inhalation of terpene stimulates the olfactory system. So once the terpene reach our brain through the olfactory system, they begin to interact with the limbic system, which controls our emotion. So there will be the overall positive effect on heart rate, blood pressure, breathing, stress. So this as we can try as a home remedy. Since it has a soporific effect, we can try. So we anyway we don't have any scientific evidence. It is given in a Siddha literature. Next slide. So study on insomnia were conducted. In that study, patients were advised to follow Siddha Pranayama. As my previous presenter had showed a demo how to do this pranayama. So this Nadi Shuddhi for our lungs and respiratory system are amazing. So what it actually happens while doing this pranayama, the pulse rate and the respiratory rate has been shown to decrease significantly following just a few weeks of daily Nadi Shuddhi practice. Long-term practice to improve a number of pulmonary health markers in young practitioners. The slow breathing technique used in Nadi Shuddhi has been shown to reduce the systolic and diastolic blood pressure of practitioners immediately after one session, and it reduces stress and anxiety. So the reference is from Siddha text Siddha Syrup Matlu. Next, Siddha external therapy. Usually, there is, as I said, there will be a Nal Ulkam. In that, they have mentioned oil bath, taking oil bath weekly 2 times. So we can use any therapeutic oil like Chukutailam, depends on the Prakriti, Vada Pitta Kaha. So after taking oil bath, we can also use this Panchatattvam. This powder is made up of white pepper, this haridagi, skin of haridagi, then kasturi manjal, that is a turmeric, wild turmeric, then gooseberry, then along with neem seed. We have to crush and grind it into a powder. We have to take 2 to 5 grams of the powder mixed with 30 ml of boiling milk. Then we have to apply to our scalp and all over the body. And after 20 minutes to 30 minutes, we can take a warm water shower. Actually, what it happens, it reduces our body heat, and it has even it has a good effect on skin. It prevents skin disease. It can be used as a regenerative therapy. The additional benefit is it gives a good sleep. Along with the turn, we can also do tokanam, that is body massage with oil application. So what it does, it rejuvenate the body circulation system. Next slide. So I'm concluding with the review that we have explored that good sleep improves immunity by enhancing the ability of T cells to adhere and destroy cells infected by virus and other pathogens. Many of Siddha facts were proven by this. Healthy sleep provides a healthy life. The evidence-based knowledge of Siddha system will open a new door in integration of all over well-being of the patient with a scientific outlook. So the take-home message will be: so these articles, what I have provided, has given you the evidence. Next slide, sir. Uh, Given you the efficacy of Siddha traditional medicine along with the yoga practice to improve sleep and immunity. Yeah, quality sleep is non-negotiable. So, though we are taking good immunity booster medicine internally or we are having a vaccine shot, but without a good quality sleep, we can't enjoy the benefit of that one. And even more randomized trials should be done in Siddha medicine to prove these facts in Siddha literature. Acknowledgement. So I'm thanking my in charge, Dr. Vicky Manikawasan sir, research officer, Ahila ma'am, research officer, and my DG ma'am, Kalangali ma'am, and I have taken these pictures from Ayush Siddha Facebook post. Thank you. Thank you for patient listening. Finally, sleep well and have a good immune system. Thank you for the opportunity.